Most of the time, gallbladder surgery is required because the patient is having pain, nausea, or vomiting. The classic gallbladder attack is somebody who develops sharp, severe pain in the right upper quadrant of their abdomen shortly after they eat. That can be accompanied by nausea or vomiting. It might not. However, some patients can have gallbladder symptoms without having any gallstones. And that's a little bit harder to figure out, but they can have pain in the right side of their abdomen after they eat, or nausea and vomiting. And then there's some testing we can do that will look at and see how well the gallbladder is functioning. And if it is not functioning appropriately, many times those symptoms will be relieved if we remove the gallbladder. The most common evaluation for possible gallbladder disease is an ultrasound. That allows us to see if there are any stones in the gallbladder, which is the most common cause of gallbladder problems. You can have gallbladder disease and symptoms without having stones. The evaluation for that would include an ultrasound, which then would not show stones, and from there we would move on to something called a HIDA scan. It's a nuclear medicine test that allows us to determine how well the gallbladder is working and if the stimulus for gallbladder contraction or secretion causes the patient's symptoms. If it's not squeezing appropriately or if it causes pain when they get the medicine, that's usually a sign that the gallbladder is involved in the symptoms that they're having and that there's a good chance they will get better if we remove the gallbladder.